Namaskaram. I am Dr. Swapna Jilla, Senior Radiation Oncologist and Head of the Mallareddy Cancer Hospital and Research Institute, Surar. Most of the people have a false opinions that radiation treatments will have so much of side effects and it is impossible to take treatment. But it's a myth. There are so many advancements in the radiation treatment techniques. So with the improvised techniques, with the advancement of the techniques, now we are able to spare many normal organs surrounding the tumor with minimal toxicities and with adequate tumor radiation dose. Today I am going to tell about the main technique, respiratory gating. Today I am going to tell about the respiratory gating. The organs which moves with the respiration, if the cancer is there in that part, for example lung, it moves with the respiration. So if we are treating in inspiration phase and if we have taken the planning CT in expiration phase, then there will be chance of missing of the tumor. Not only that, if other tumors which moves with the respiration, we can decrease the adjacent normal tissue toxicity and accurate tumor doses, tumor prediction, tumor directed treatment with the respiratory gating. So what we will do in this respiratory gating? So there are different techniques like breath hold techniques, active breathing coordinator, ABC, DIBH, deep inspiratory breath hold. And breath, they have to hold the breath while taking the treatment. Other techniques is 4D CT. So today I am going to tell about mainly respiratory gating by the ABC, active breathing coordinator technique. So in this, if we are, what are the advantages? So if we take the breast cancer, so if we ask the patient to hold the breath while taking the treatment, especially for the left breast cancer patients, the respiratory gating is very much useful. Why? Because the heart is just below the chest wall, left side chest wall. So already breast cancer patients has to receive the chemotherapy, which is little bit cardiotoxic, adriamycin chemotherapy. So if we give radiation in without respiratory gating, there is more chances of getting radiation to the heart. If we go with the respiratory gating technique, by asking the patient to inhale almost 1 to 1.2 liters and hold the breath while treating, the lungs will expand and push the heart away from the radiation field. As a result, the heart will receive less dose compared to the non-breath holding techniques. And another, if we take the lung tumor, usually lung cancers will occur in smoking patients who have already COPD, chronic COPD changes. So, and added to that, the tumor, the cancer is also in the lung itself. So, if the tumor is here and we have to take the margins, safety margins, if we are not taking the breath hold, we have to take almost 1 to 1.5 centimeter margin around the tumor. As a result, means if without breath holding, if we are taking along with the tumor and 1.5 centimeters margin all around, then the normal lung tissue getting radiation dose will be more. So as a result, there will be more chances of radiation induced lung damage or radiation pneumonitis. If we are going with the breath holding technique, that means with the breath holding technique, if we are able to, if making the patient to hold the breath while taking the treatment, then we have to decrease that margin. We can decrease that margin, safety margin. As a result, the normal tissue undergoing for the radiation will be decreased and the radiation induced toxicity will be decreased. So apart from this one, other where we can use the respiratory gating is even in the solitary liver lesions where the radiation SBRT is planned. Then if we go with the respiratory gating, then we can decrease the chances of missing tumor and increases the normal tissue sparing. So this is the advantages of the respiratory gating. So, especially in lung cancers and left breast cancers and the liver solitary mets and other remaining cancers which moves with the respiration, if we go with the respiratory gating technique, we can decrease the chances of normal tissues and increase the probability of the tumor control. Thank you.